let's talk a little bit about quality latch. So breastfeeding your baby should be relatively comfortable, and probably one of the most important things is that you position yourself in a way that's comfortable in order to optimize milk transfer. So the first thing I would recommend is that you bring your baby up towards you when you're breastfeeding. So whether that be laying next to your baby side by side in bed, and that's called a side lying position, or whether that be providing pillows across your lap in order to raise the baby up to the level of the breast. What we don't want is you leaning over to feed the baby because you'll get pain in your neck and it also won't optimize milk transfer. The other thing to consider is the position of the nipple in the baby's mouth. Almost the entire nipple should go in the baby's mouth. The edge of the nose and the bottom of the chin should touch the areola, which is the dark part of the nipple. The baby should look like it's eating a giant cheeseburger, so it should have a big open mouth, and it should have what we call fish lips, meaning the lips stick out and flange out outward onto the breast, like this. If your baby's lips are tucked in, the baby won't be able to get the nipple back into the mouth. The reason why we want the nipple so far in the mouth is because the nipple actually has to go all the way into the back of your baby's mouth in order for the baby's lips and gums to be massaging the edge of the nipple in order to get the milk out of the breast. So if the baby is too shallowly on the nipple, the baby will actually just put pressure on the nipple, which will cause damage and impair milk transfer. So if you're experiencing a lot of pain or the baby's not drinking well, the latch may not be deep enough. So we'll work with you on positioning to see if we can get that to feel better. So one thing about latch that I tend to see with a lot of parents is that as they're breastfeeding the baby, they become worried that the baby has too much of the breast in the mouth and that the baby is getting smothered by the breast. So they start to move the baby away from their chest in order to see the baby's face. The good news is, if your baby is suckling at the breast, your baby can breathe. The baby will not suckle if it can't breathe. The problem with moving the baby away is the latch becomes less deep, and that can cause pain and actually impair milk transfer. So it's always important to remember that if the baby is drinking at the breast and suckling, your baby is breathing just fine. And that's a really nice, reassuring thing. The other way you can know that your baby is breathing well is that you'll see that the lips and gums are nice and pink. Babies sometimes will have blue hands and feet. That's totally normal. But if those lips and gums are nice and pink, you know that your baby's getting enough oxygen and is breathing normal. If you have any questions, please let us know. I know that this is a very complicated process and can be a very stressful time for everybody. So it's really important that you reach out to us and let us know if anything doesn't seem like it's going right. We want to try to answer your questions and make sure that you're getting the attention you need in order to have a successful experience. So again, please make sure that you reach out to us anytime.